So if we could go to the next slide, Helen. Just another introductory one to say hello and welcome to this session with Research in Practice and colleagues talking about the pre-birth assessment on Change Project. So really delighted to welcome you. I'm Laura Bracey. I'm the Research and Development Manager at Research in Practice, and I've got three other colleagues here joining me today to talk about the journey that we've been on through this Change Project. So I'll let them introduce themselves. So Helen, did you want to go first?
Yes, good morning everybody. I am currently Principal Social Worker for Rutland County Council Children and Families Service.
Claire, do you want to go next?
Thank you, Claire Turnbull. Good morning everybody. Designated nurse for safeguarding children and adults for the Integrated Care Board. So I cover Leicester, Leicestershire and Rutland.
Mandy.
Good morning everyone. My name's Mandy Goodenough and I'm the Child and Family Principal Social Worker for Leicestershire County Council.
Can we get to the next slide then, please? So the workshop of this 1 hour that we have together, the objectives are, I'm going to give a bit of an overview of what Research in Practice is, what a change project is, and then talk a little bit of the background to the pre-birth assessment change project that we have been working on together. And then I'm going to allow my colleagues to talk about the impact that being on that journey has been for their local areas and how they've been working together really kind of effectively as an impact from undertaking that change project, and for you to hear about some of the changes that are underway and how you might be able to get involved in any of that. So that's kind of and then a next steps and any questions, there'll be space at the end. It is quite, we are sort of relaying a lot of information, but if you've got questions throughout, please pop them in the chat or do put your hand up. We don't want it to kind of feel like just an information overload. It can have a bit of interactivity. So kind of feel free as if we were in a room to just say, oh, can you explain that bit a bit again? Or I've got a question about that. Feel free to do that in this session. Next slide then, please. So hopefully some of you may be aware of Research in Practice. If not, I thought I'd just give you a bit of an overview of what Research in Practice do. So we are an organisation of over 140 organisations. So we have a lot of the local authorities in England that are members of our network. Also national organisations such as Ofsted, or charities such as Barnardo's. And we sort of work with that network to think about the key priorities that you're working within, and think about the learning resources that we can produce to help support you in your jobs. All our resources are based on an evidence-informed approach. So that is, there's triangulation of evidence, that is practice expertise, lived experience and research messages. So we're always thinking about whether that's an event, whether that's a publication we're producing, whether it's a podcast, thinking about those voices within the room to ensure that they're incorporated into any of the messages on any given topic. This kind of diagram, sort of the 360 support overview, gives you a taster of some of the resources we produce. You may have heard clippets of podcasts, for example, or you may have seen some of our publications, or you may have been to an event such as this or a full day workshop. So there's lots of resources to kind of be getting involved with at Research in Practice, and Change Project is one element of that that offer that we do for our members. So next slide then, please, Helen. So who can access Research in Practice resources? So I talked a little bit there about the membership, and Leicester City and Leicestershire are both members of Research in Practice. So what you have to have is a local authority email address, and that's all you need, and you can access all of the resources. You can sign up to an account, and that is as simple as that. Rutland colleagues can be gifted accounts through Leicestershire and Leicester City. So we have got a nice arrangement with Rutland, so that Rutland colleagues can also do that. You can't do it through your Rutland account without having sort of spoken to colleagues in Leicestershire and Leicester City. If you're a Rutland colleague in the room and you don't have access, I'll pop my email address into the chat once we've finished, and I'll ensure that you're guided to the right people to ensure that you can ask about those gifted accounts. And so you can then use these resources to support day-to-day professional development. helping you be more evidence informed, and you know, really taking the time to reflect on your practice and sort of thinking about the resources that would best help you. You can set up on your phone or your laptop. So if you go on to the next slide, please, Helen. So you go to this website, you click create account, you just complete all the information. It's not a long process. And then once you get through, you'll be able to access everything. And you might want to go to the events and learning, where we're doing kind of a rolling program of every sort of the last Wednesday of each month, where you kind of how to kind of use research in practice. And that's just an hour session where you can kind of really get to grips with all of the research in practice content. So that's just a bit of an overview of, if you've not heard of research in practice before, what it is and what you might be able to access as part of that membership that you have signed up to. Next slide, please. So one aspect of that membership offer is a change project, and this kind of diagram here kind of shows the process of a change project. So it brings together groups of partners, so those members who have signed up to research in practice, to explore pressing challenges and priorities. We recruit to a development group, and then we have experts who are leading the sessions throughout a change project programme. And we're again using that triangulation of evidence throughout a change project. So lived experience, research messages, and then practice experience within that cohort that has been recruited to for that change project. So we're formulating responses, solutions, tools and materials to support change in policy and practice on a given area. So change projects usually run for 18 to 24 months from inception to the launch of final resources. If we were to look at this diagram here, I'd say we're about halfway around. So we've done a programme with colleagues. So we've had a cohort of colleagues that we've worked with thinking about a pre-birth assessment. We're now thinking about how we implement much of that learning into some resources that we're going to develop, so that it's not just having an impact on the colleagues who were part of that programme, but it has a wider impact in that you can also access resources that are based on much of the learning of that project programme. So what I'm saying is keep your eyes out, because there'll be some resources coming out from this pre-birth assessment change project. If you want to see an example of a completed change project, I will pop in the link where to find some more information about different change projects that have happened at Research in Practice. One that might be particularly of interest to you is the working with recurrent care experienced birth mothers, which formulated, you know, a lot of the learning that fed into this pre-birth assessment change project. So I'll pop a link in the chat once I've finished my presentation bit, so that you can have a look at the resources that were compiled from that change project, and it gives you a flavour of what I mean by some resources that will be developed from the change project. Another thing to just mention is, you know, trauma-informed practice formed a large basis of kind of the learning that was part of the pre-birth assessment change project. We're just about to send invites out for the next change project, which will be a joint project. So there'll be a children and families one and an adults one run at concurrently on the topic of trauma-informed practice. So if you'd like to know more details about that change project, again, I'll pop my email into the chat and we can I can send you some further details. Can I have the next slide, please? So talked about what research in practice is. I've talked a little bit about what a change project is, and now I'm going to think about what the pre-birth assessment change project was and why it was formulated. So the pre-birth assessment change project was led by Claire Mason from the Centre for Child and Family Justice Research at Lancaster University, and was informed by the Born into Care series. So some of these resources here that I've got on the slide, that's with the Nuffield Family Justice Observatory, and builds upon the previous change project that I've just mentioned on recurrent care proceedings. The programme we developed aimed to build on the learning and work with local authorities to improve practice in the pre-birth period, to ensure wherever possible babies are cared for safely within their own families, and where separation does take place, this is done in a sensitive and compassionate way. So that was kind of the starting point, I suppose, of the pre-birth assessment change project. Some of the key findings from the Born into Care research did include, so infants under 1 make up over a quarter of all children in care proceedings. Secondly, newborns less than 7 days old make up over 1/3 of all infants in care proceedings. Thirdly, overall upward trend is what the research was shown, an overall upward trend from 2006 to 7 to 2019 to 20 in England and Wales of these findings. There was a marked regional differences in the rate of this increase. Fifthly, the mothers of nearly half, so 47% of the newborns in care proceedings have been party to previous care proceedings. Short notice hearings for newborns have increased in England and Wales. Higher rates of urgent hearings in the north of England and Wales were compared to the south of England. The majority known to maternity services at early point of pregnancy. And lastly, high levels of mental health need. So that's kind of the research basis of where we came to for this pre-birth assessment change project. And if we go on to the next slide, then please, Helen. So these are kind of the core topics we thought about on the programme. So there were 7 sessions that everyone attended. So the recruitment process was very competitive. So we had quite a large group in this change project. So we had 17 local authorities. We had 2 colleagues from each local authority who made up this cohort. They were predominantly in roles of service manager or principal social worker, and we had some colleagues from health join us. We were very lucky to have Claire, who was part of the change project, all the 7 sessions. And we also had one session where we invited more health colleagues to input into the content. So that was, really valuable in having kind of those different perspectives as part of that cohort. The programme topics were informed by research and really focused, I'd say, on trauma-informed practice and the ways we can best support practitioners to develop sufficient knowledge and skills to engage effectively with parents at the earliest point in pregnancy, that early identification and engagement. Offering support and intervention in a way that gives parents the best opportunity to overcome the difficulties as defined by both the parents themselves and the professionals working with them. So again, thinking about that evidence-informed approach to everything we're doing here. And thinking about making the best use of the kinship network to support parents during pregnancy and to prepare parents if a separation is likely and ensure that further trauma is minimised. And then finally, offering support post-separation to prevent a further downturn in parental functioning. So those were the key themes that we focused on throughout 7 sessions. And I'm going to pass over to my colleagues now to tell you a little bit about what that felt like for them, what it's meant for them, and what's happened since being on that change project. So Claire, I shall pass over to you first.
Thanks very much. That's really helpful. Can everybody hear me? Because I've only got a single screen. Yes, I can see Laura nodding. Thank you very much. Okay, so what I wanted to do is sort of set the scene about where we were coming from, Leicester, Leicestershire and Rutland wise, before we actually started with the change project, because actually we were looking at the pre-birth procedures and we were already reviewing the pre-birth procedures. So I just wanted to kind of set the scene for you in terms of where we were at. Some of you as practitioners may have been involved in some of these cases. So between 2020 and 2022 across LLR, there were rapid reviews and local safeguarding child practice reviews, and we'd had 8 babies that had died, unfortunately. And in 3 of those cases, 4 of the babies died, including a set of twins. And alongside some of the things Laura's saying about vulnerabilities, all of those mothers in those cases had substance misuse issues, homelessness, and were also sex workers. So as I say, we were already looking at the pre-birth procedures. And there were a further lot of cases in between 2017 and 2020 where substance misuse and neglect were a feature. And then there was a case in 2021 where a baby died, where the mother had learning difficulties. And so clearly there were a lot of vulnerabilities that we needed to look at, and we're already changing our procedures to put those things in place. And these are listed on the slide here, slide 10. So substance misuse, as I say, homelessness, sexual health. And what we did was we worked with those services. In fact, the policy and procedures group had a task and finish group that I chaired, so that we looked at those. So we actually worked more strongly with other services to change things. So we now have meetings with, well, we had meetings with Turning Point and the specialist midwives, but now children's social care representatives come into those meetings as well, and share drug histories and try and work as early as possible with those parents to improve outcomes. In terms of homelessness, in the case of the sex workers, the police are trying to pick up those pregnant sex workers earlier and refer them on to support services. And we did a lot of work with hostels and sexual health services to enable sex workers to get access to sexual health services at an early stage. There was a case where the mother had tried to actually terminate that pregnancy, and there was issues around her ability to access those services and the ability for the sexual health services and British Pregnancy Advice Service to actually know about her history. So it's about sharing things at an appropriate stage in a sensitive way to actually support those parents as soon as possible. Sorry, my slide's going a bit funny here. Do apologise. Right, I think I've covered all of those. Yeah, okay. And also in terms of domestic abuse, the multi-agency procedures have been updated in the light of the things that we learned from those cases. I've put non-engagement, but actually we don't like to use those terms, especially when it's trauma informed. It's about how we work with people to get them the services at the earliest stage. So those Turning Point meetings that I've mentioned, there are also now maternity and children's social care forums across Leicester, Leicestershire and Rutland to increase early referral. One of the issues that we found on the Change Project and in the practice that we'd done up to date was early referral is absolutely a priority, and having a consistent worker. And we also looked at men and invisible men and men in those situations, particularly Turning Point have done a lot of work with men, identifying men where their partners are pregnant. And we've done some multi-agency practice guidance, which was developed in 2023 sorry, I've lost my train of thought there. So yes, we've developed practice guidance, and you'll be able to find that on the multi-agency website. And then there's been some training by Jane Whiffin on baby's first home and the impact pre-birth. Could I have the next slide, please? So we did join in to research to practice to further develop the pre-birth assessment practice. And as has been talked about by Laura, it's been quite a long journey, and we're not at the end of the journey yet. What we did in Leicester, Leicestershire and Rutland is we found out about the Change Project and made a joint application between Health and the county. And then we found out that there was interest from Rutland and the city, and we made a Leicester, Leicestershire and Rutland application. And I was the person from Health, like Laura mentioned, and I think it was really beneficial that we all went together and did a joint application, which didn't happen with other people. And I think that was really beneficial that we all started together, and we'd done some pre-work together as well. So there was initial meeting almost a year ago now in December 22, and then the project, like Laura's explained, went from January to July. Once a month we had a full day. It was quite a heavy day, lots of really, really useful specialists talking to us, and also all that interaction between the local authorities was really helpful. And like Laura mentioned, there was a day where a lot of maternity colleagues came from across the country. So I think there was a lot of sort of, maybe cross-pollination is the wrong word, but that's what it felt like. It was really helpful. And to also look where people had done sort of concentrated pieces of work where they'd worked in a multi-agency way. So that was sort of mirrored in terms of the way that we worked with the project. And then what happened in Leicester, Leicestershire and Rutland was we reviewed our multi-agency procedures with the development leads. So the pre-work that I talked about in terms of the deaths that we'd had of babies and the rapid reviews, that was with a different group of people. But because we had all met on the change project, then that task and finish group changed and we were influenced by the change project. That's not to say the other colleagues weren't also experts, but what was really useful was we'd kind of bonded and worked together in the change project, and we had those other connections with other people. So as well, we did some work with Lincolnshire, and Lincolnshire came into some of those meetings, and actually we were lucky enough to have Laura in our meetings as well. So all of that has been really benefited by being part of the change project. Next slide, please. So the final thing that has happened in parallel to all of these, the change project and the work that happened before, is we did a pre-birth audit to actually look at what our practice was actually prior to the change project. So the case file audit was looking at whether we'd actually applied our pre-birth procedures. So that was the pre-birth procedures that have been somewhat changed, but not as changed as they're going to be by the end of the change project. I hope I'm making that clear. And that was undertaken during 2023. So these were babies across Leicester, Leicestershire and Rutland. So that was 5 cases from the city, 5 cases from Leicestershire and 2 from Rutland. So 12 records that were reviewed, and these were babies that were born in January. So that was before we were influenced fully by the change project to see whether the current pre-birth procedures were applied. So what worked well, that was in most of the cases. The actual report, which I have just finished, is looking at the majority of the cases, and if you want to see it in more detail, it will be available. At the moment it's in draft form, it just needs to be approved by all the people that were involved in it. So the things that were good, there were clear histories of risk evident, and timely action was taken in the majority of the cases. There was some particularly creative and hard work by social workers, engaging the parents, working in a really sensitive way, looking at their backgrounds, working with them, working to find out what their opinions were, that were very effective and very creative. And they kept on trying, and they kept on being hardworking and going out and out and out to see them. And in 3 of the 12 cases, the babies remained with both parents or one parent. So we had 3 out of the 12 cases, which I think is really, really helpful. I'm sorry if you can hear a toddler in the background. There's a toddler in the background. And there was also really good multi-agency working and good working across health, again, in most cases. And the GPs across the ICB had good knowledge of the risks to the unborn baby. So they were aware of the mothers, they were aware of the unborn baby and the risks and what those risks were in detail. Next slide, please. So things we were more worried about. The GPs weren't always invited to the case conference, or if they were, it was very last minute. So they didn't have sufficient time to either attend or send a report to that meeting. Sorry, there was a need for better recording and evidence of the voice of the child. And that was, we've got a voice of the child in the background here. And a better understanding of the father and his support network. So often there wasn't the work put in to find out more about the father and his support network, which was common in a lot of other cases as well. Sometimes this wasn't possible. We had a couple of cases where the fathers were in prison, but on the whole, it wasn't done in a lot of depth. In terms of cultural diversity and the needs of the unborn, and particularly the siblings, that wasn't always very effective or wasn't done in detail, and there wasn't thought about how that unborn child, or when it was born, would be linking with the siblings. And there was somewhat a lack of evidence of effective working with the parent where there are learning difficulties or learning disabilities. And the record keeping would have been better with better use of genograms and up-to-date chronologies, and that they were regularly updated and shared with the parents, and better cross-agency communication, which comes up often. Next slide, please. So the multi-agency recommendations that you can see there sort of reinforce what I've said were the concerns. So better understanding of learning and increased skills with parents with learning disabilities and learning difficulties. Progressing the digital solution of maternity and health visiting communication. So I think sometimes people feel that health is one thing, and we obviously have very different IT systems, or people might not be aware of that, but certainly there are issues around the services in the hospitals and linking with the health visiting services in a clear and quick and speedy way, particularly where there are vulnerable parents and vulnerable cases. The culture, race and ethnicity, better reflection and learning in this area, which links to the concern, and cross-agency presence at case conferences. So there were a few cases where there was somebody from health there, but somebody from health doesn't mean that you're represented by maternity and health visiting. And post-separation support, which actually people were really willing to learn about, where babies have been removed into care, some help about those parents going back to the house with no baby, with maybe a buggy there, with maybe things there to actually give them some support, and maybe sexual health services. We have talked about hope boxes, which if people want to know more about the Change Project comes up. So it's like supporting people and recognising that they've had a loss as well. And next slide, please. So we've updated the pre-birth, post-birth practice, and they're going to be signed off tomorrow, hopefully, and a lot of work to incorporate trauma-informed approaches. So my colleagues are going to go into more detail about that.
In terms of the work that we've done to update the pre-birth and post-birth procedures across Leicester, Leicestershire and Rutland, as Claire has already said, we have been meeting up quite regularly as part of the pre-birth change project, and then more recently in terms of updating these procedures, trying to read them with fresh eyes really, and thinking about, given what we know now around trauma-informed perspectives and equality and diversity. So we have updated to incorporate that trauma-informed approach and remove any heteronormative or gender-specific language. And you can test us on that. So once they're out for publish, if you spot anything that we haven't changed, then let us know. We've related this to recent research and information gathered through the project. So there was all sorts of stuff available, and I'm really looking forward to the resources that come out of it from the final end, because they'll be really useful for us in practice. We've been thinking more about how to manage that separation and the support that's available to parents post-separation as well. Assessment and understanding risk is really important. And that mentalisation of the unborn child. Some of you will have seen resources as part of this project. Certainly at the opening session for the Festival of Learning, there was a really useful video about what does it feel like to be that baby in the womb. And if we can get parents thinking about that experience, it can be really helpful for them in understanding the developing world of their unborn child. There was something else, I think, Mandy, that you added. Or was it around the mentalisation?
I think it possibly was around that, and I think it was about, no, I know what it was, Helen, my memory's not great. It was about supporting parents post separation, because that's something that we could really improve upon. Not only in the research we're saying, you know, we're not always great at that and experiences aren't good, but locally not so. But I'll talk about that from a Leicestershire perspective a bit later on. So it was that. But I think for me a big thing was about language, wasn't it? Looking through that and using language that was trauma informed and thinking, how might that land, and do we need to think about this in a different way, particularly from a non-engagement perspective, because the research that Laura talked about in terms of recurrent care proceedings, when you look at it, that was one of the issues why local authorities were going into court for non-engagement. But when you looked at it from the women's perspective and what they were saying about just how hard it was for them to work with people, then it does give you a totally different perspective on what's happening.
Just out of interest, we've got quite a few people from across the region on the call. Are you all familiar with how to access the local policies and procedures from Safeguarding Partnership? Anybody feel brave? You can pop it in the chat if you want. I'm hoping Derry will put, not quite, fair enough. Derry, if you are still on the call, are you able to put a link into TRIEX for the partnership?
To the safeguarding
the policies and procedures, yeah.
Yes, sure.
Thank you. Because then people will be able to have a little bit of a look and we'll know where to go to get the new version. But I'm sure we'll be doing a launch, will we, Claire, once it's signed off? Fab. So thinking about kind of the more practical changes for our practice in Rutland then, we have, I mean, one of the first things we did was making sure that our staff know where the policies and procedures are, and that they're using the most up-to-date versions of those as well. It's surprising how quickly people will save a copy and use that copy rather than going back to the original source, and then of course you miss out on the updates. So that was one of the things that we did straight off the bat with as part of this, and to make sure that we know any pregnancy where there is risk identified at any stage can be open for an assessment, and is an appropriate referral in. So we don't have to wait to a certain stage of pregnancy before we would start to assess risk and think about what's going to be safe for the baby in the longer term. We made sure that our practitioners were using the most up-to-date version of policy, and we also now have in place agreement that where an unborn child is referred to children's services and the threshold for assessment is met, that will move straight away through to our long-term team rather than having a separate referral and assessment at the front door, and then moving across for the more in-depth pre-birth assessment and work around that risk. We'll get one worker working with the family straight away that will see them through their involvement with us. So there isn't that handoff point during that really stressful period of pregnancy. The other thing that we're doing in recognition of how difficult and challenging this is for parents is that we are co-allocating a social work assistant who can support parents through the process, particularly where we're in public law arena, so where we're looking at entering into court. So that there's that support. Social workers' focus quite rightly needs to be on understanding risk for baby, but we want to work in partnership with parents. It's really important that we do that. The other thing that we're doing is making sure that we understand the data. So we have pulled all of our recent, so over the last 12 months, and we're looking at commonalities and areas that we can work harder on in the future. So that's us in Rutland. I'm going to hand over to you, Mandy, if that's okay.
Of course, thank you, Helen. So good morning, everyone. So for us, it was just a fantastic opportunity because I'd say nearly for 2 years now, we've been on a journey of becoming a trauma-informed children family service across our services, and really thinking about what that meant. So for us, it was thinking about, well, we started by actually sending a survey out to all of our staff to really understand their understanding of trauma-informed practice and how confident they were with that, and what did that look like and what did they need from that, and then that really informed us on the journey. So we do have a suite of training for our staff about that really looks and understands for trauma. So it's mandatory that all of our staff access a foundation to trauma, and then once they've done that, they can access different parts of training, one of which is around the potential impact on parenting capacity, and then there's one on contacts and the impact of in relation to contact. So it's a real big thing for us at the local authority to work in this way. So this change project really was an opportunity to complement the work and the journey that we were already on. And what that's doing, that's informing our training, because already that training was informed by the recurrent care proceedings research, and it formulated on that, but then it made us think about our pre-birth assessments as being part of this change project. So for us, it just was a wonderful opportunity and fell at the right time for us. And at the time, at the same time, we were already looking at, we've got a working group that looked at recurrent care proceedings. So as this is going on, we're in part of the National Change Project. So the two linked together, and one was informing the other. But to start that, and I have to say, going out to staff, we delivered the session on what the removal at birth research was telling us. And we went out and we shared that with all of our staff. And I have to say, there's been a real enthusiasm and commitment to do things in a different way, because what we know at the moment, we can do things a lot differently. And I'll talk about what we know about our data in a moment. So we shared the research findings with all of our staff, and many of them have then gone on to join the work that we're doing. So in terms of our recurrent care proceedings group, when we started that, we didn't have a clear picture of who was coming into our care and when and how frequently were we removing their children. It was really difficult to get that data, and that's something nationally that's been an issue, that it's really hard to find that. So as a result of that, we created a dashboard, and from that, sadly, what we can see, as is nationally, the greatest number of children coming into our care are newborn babies. So, and they've often had other children removed. And that's not a position we wanted to be in the local authority. Now, we thought that was the case, which led to this working group, because at the moment, we don't have a service to support parents who've had their children removed. At the moment in the local authority, the focus of the work tends to be on arranging contact and facilitating contact, not on supporting parents who've already had children removed about what they might be done differently. So they come back and they find themselves in the position where they've not been able to access the services that were identified in the last set of care proceedings, maybe because they weren't available. And so it's then we're kind of setting them up to fail. And that's what we thought was the picture. And what this group has done is look at the research and helped us really understand what the local picture is and what can we do differently. Now, what's been fabulous about that, we've gone out to parents who've had their children removed to talk to them about that experience. Clear, and a big message from that has been they would like an advocate through that process, because whilst we share with them what will happening for them, they are not taking it on board, they are not understanding the processes, they don't understand necessarily the difference between child protection and going into the court arena, and that's really difficult for them. And they feel, and actually this was interesting because it's the same thing that the research was saying, women in the research were saying, is that they feel we've already made our minds up, that they don't feel that they're coming into an even playing field, that we've already made our minds up. And there's a lot of shame around that. So what they're telling us is going to really inform the work that we do going forward, and we'd like them to be involved in that. And we've also gone out to lots of different local authorities that have different approaches to working with parents who've had children previously removed and having children removed at birth, to see what works for them, to influence what we might do in our local authority. And I feel very passionate and very privileged to be part of that work and talking to parents. And after one conversation that I had with a mum, I got an email from her community psychiatric nurse saying that that conversation that we had really helped her in terms of her recovery, and because she felt listened to and she'd had a voice. And I just think just having a conversation has been really powerful for a lot of these parents who feel disempowered through the process. So we are at the stage now where we're looking at actually what would that look like for us. So I'm really excited about that, and we're working with both women and men, because that's really important, taking on what the research tells us and what parents told us. And linking to that, so I've talked about the creation of the dashboard, but I'm very mindful that often we're not using contact as an opportunity to create parental change. Usually it's us sitting there observing, tapping away on a laptop. And if you think about what that feels from anyone's perspective, and I was listening to a webinar recently where a post-grad student had done research on this in terms of how contact is perceived in the arrangements where it's foster to adopt placements. And what's interesting, that everybody has a different view of the purpose of contact and what that looks like. And what parents are saying, you expect us to be the best parents that we can be, whilst putting us in an environment where we're observed and frightened to make mistakes. And so what we're thinking about and looking at in that contact pilot is, how might we use contact in a different way? How can we use it as an opportunity to create change with those parents and make that meaningful? And how does that inform the work going forward? And look at, actually, because a lot of the time, particularly children in care, we end up it remains supervised for a long time, and does it really need to be? So I've got 2 pilots going, one in children in care and one in a locality team, to think about how do we do contact in a different way that's trauma informed. And again, as part of that, we're talking to parents, so it's very much led about people's experience of our service, because often we think, it is quite interesting that we think that we share things we do in a way, but it's not landing with our parents. So we need to think very differently. And as a result of all this, the local authority is very proud of what it's doing, and want that. We're going to be inspected next year, and we've got our annual conversation in December, and they've asked that it's about that we talk about the trauma informed practice that we're doing within the local authority, and what difference it's made. Now, twice a year we have a challenge day with our senior management, and we've actually had practitioners came in and were sharing how they use all of this to inform the work that they do, and it's really powerful. And our leaders want them to come into that Ofsted conversation and share it, and that is all a result of being involved in all of this work. And for us, being in that change project has been a fabulous opportunity to hear the research, gain tools and perspectives that we might not have got before, and it really has, and I have to say, informed what we're doing on the ground. So I just want to thank Laura and others for allowing us to be in that, and I very much would like to be part of the trauma informed research project going forward, because I'm sure there's lots that we can learn.
I think we've come to the close of this research in practice and colleagues session. So thank you for questions and reflections, and Claire, Helen and Mandy, thank you for kind of presenting and talking about the impact it's having in your local areas. I think we're now passing over to Neil and Jane, is that right? The last bit.
Neil will have closing. Please, Jane, let us know if you want to add anything as well. Thank you.
Yeah, thank you, and thank you for that last presentation. It was interesting. I think the conversations at the end are when we know that we're having an impact with our presentations, because it gets people to think, to process, what does this mean for me going back into practice? How can I do things differently? How can I improve what I do? And certainly that's been the feedback that we've been getting, you know, over the whole festival. You know, there's been 15 sessions that have taken place. We've had over 350 bookings and over 300 people attending the course and the courses and the programs, the workshops. And you know, obviously that in terms of the thanks, you know, obviously we need to thank all of our speakers, all of our presenters, all of our facilitators for each of the sessions that have been undertaken. You know, already there has been, you know, some early scans and reviews of the feedback, which you know has been really positive, and certainly you know, means that, you know, already we can say that this has been, you know, another successful festival of learning. So as I say, thank you to all of those speakers, thank you to all of those people that have attended, because, you know, the presentations aren't going to work without an audience, and without that audience engagement, and without you then thinking about what you're going to do and how you're going to take away and be influenced in your practice to move forward as a result of this. The spectrum, obviously, we started with Jane, who I'll hand over to shortly, who looked at safeguarding babies and the womb and the baby's first home. And then we've had other sessions looking across from good quality childcare, legal processes, pre-birth assessments, taking children into care, myth of invisible men, ICON and the work that's been rolled out around ICON, safer sleeping, substance misuse, parental conflict, a full range of things to influence the support of babies and small children as they come into the world. One of the things that we're going to do is some of the presentations were oversubscribed, and we couldn't get everybody in. So what we are looking to do, all of the sessions have been recorded, so we're going to be looking at how we can share the recordings and what we will do for that to enable other people to get access to the learning. We'll be looking at delivering some more sessions in the new year, again for those workshops where there was a particularly high number. I mean, obviously, I was asked to speak. I should have probably said this right at the beginning. I was asked to speak because I'm the chair of the training subgroup for both Leicester Safeguarding Children's Partnership Board and Leicestershire and Rutland Safeguarding Children's Partnership Board. So the work and the learning will go on from that, because that will come back into the group where we will analyse the data and look at the evaluations, look at what's gone well, look at what we can do to improve. So hopefully then this time next year we can put on an even better festival of learning for you. So I'll hand over to Jane now to seeing as you're here, Jane, but just to say thank you to everyone, the participants, and also obviously to Liz and Deria, who have done a tremendous amount of work in pulling this really successful festival together. So thank you to all. Hi, Jane, over to you, Doc.
It's really good to hear the sort of tail end of that conversation around this is such an important area of practice. I'm just in the middle, it kind of brought me full circle, because I'm just in the middle of a review of a very sort of complex family where I've just got to 7 children being removed from one mother who was sexually abused in her childhood, and just reading how the children had been removed because of her poor mental health and not because she had been horrendously harmed and abused and traumatized herself. So I'm sort of back to thinking about that and thinking about relationships, consistency, all the things I said last week, actually, which we heard from your last person contributing, starting planning early, building relationships, all of those things. So great to hear that that's happening. And yes, Liz and Deria have done loads of work to kind of really make a difference to family and children's lives. So that's really why we're here. So that's all I wanted to say. Thanks, Neil.
Thank you very much, Jane. Thank you, everybody. I'll take the thank yous in Liz's name. She's the real creator of that. Thank you. I think this is the end of our session. Thank you for everybody who gave so much of their time. Neil, Claire, Helen, Mandy, Laura, thank you very much, and goodbye.
Thank
See
you
next
very
time.
much.
Thank
Thank
you.
you.